Hello, everyone, and welcome to the TCOYD Quiz Show, where we will be quizzing 3 of the world's leading diabetes experts to find out just how much they know about type 2 diabetes. Now, let's meet today's contestants. He's an endocrinologist at the University of California, San Diego, the founder and director of TCOYD. He's been living with type 1 for over 50 years, and he's a part-time rock star. It's Dr. Steven Edelman. She's an endocrinologist from UCSD, TCOYD's Type 2 track co-director, and from the looks of this photo, she's clearly from the future. It's Dr. Tricia Santos. And finally, our last contestant is our third UCSD endocrinologist, TCOYD's Type 2 track co-director, and from the looks of this photo, he's clearly stuck in the past. It's Dr. Schafer Boeder. And now, here's your host of the TCOYD Quiz Show, the one, the only, and I promised him I'd say handsome, Dr. Jeremy Pettus.
Thank you, Johnny. Welcome, participants. Welcome, viewers, to the TCOYD Quiz Show, where you're not only going to learn a ton about type 2 diabetes, but we're going to find out once and for all who's the smartest doctor in the room besides me. Now, let's take a look at the board. And they are diabetes history, lifestyle, drugs, diabetes care, and stay positive, where, it's just some good news about having diabetes. And I should say drugs, these are type 2 diabetes drugs, so don't get too excited. All right, now some rules for this show. So this isn't technically Jeopardy, but we're going to still maintain Jeopardy rules here, where you have to answer in the form of a question. Now, why are we doing that? Well, we don't really care, but it just makes it more fun, more likely that people are going to mess up, which makes it more entertaining for you at home. Now, the last time we did this for type 1 diabetes, Steve just was decimated by Tricia and Schafer and blamed his loss on the buzzer issue. So we've made sure that his buzzer is functioning completely appropriately now. And so hopefully to get him to stop talking about it, we're going to let him go first. Ooh. So Steve, you have control over the board. Why don't you go ahead and get us started?
Let's go history for 500.
Wow, right out of the gate with diabetes history for 500. The answer there is SGLT2s were discovered from this natural source. Anybody? Anybody? I see Steve's finger.
I'll try it.
Okay.
I want to say it was a type of tree.
Okay.
She didn't say it right.
And any particular part of the tree?
What is the bark of a tree?
Yes, that's actually right. So the compound there is actually called florazin. It's from a apple tree bark. So interestingly, we always talk about natural, drugs for diabetes and things like that. A lot of our drugs that we use, commercially actually come from natural sources. I don't know who was eating tree bark and figured out that it had some kind of effect on lowering glucose, but it's interesting that it actually came from a tree. So way to go, Tricia, jumping out to a big lead there.
Well, that one scared me a little bit, so I'm going to go easier. Let's do drugs for 100.
All right, and the answer there is, this is the first-line drug for most people with type 2 diabetes. Ooh, Schafer.
All right, what is metformin?
What is metformin? That's right. So metformin's been a drug that we've had around for a long time. It's still the drug that we use for most people when they're first diagnosed with type 2 diabetes because it's really effective, it's cheap, it's well tolerated. So if you have type 2 diabetes, there's a good chance that you're on metformin. It's a good drug. Okay, so Schafer, you got the board.
All right, let's try stay positive for 200.
Stay positive for 200. The answer there is, if you don't feel like doing something, you can fake this. Ooh, Steve.
Fake your blood sugar test.
Okay, so...
What is?
Those were both wrong. So, Tricia.
What is fake a low blood sugar?
Yes, fake a hypoglycemic episode. I do this frequently when it comes time to, want to have to take out the garbage or something. It's like, oh, darn, my blood sugar's low. I really wish I could. But my blood sugar's low. So a positive thing about having type 2 diabetes, using low blood sugars to your advantage. Tell them Uncle Jeremy sent you. All right, Tricia, you're up.
Let's try diabetes care for 300.
We are all over this board. I like it. Diabetes care for 300. The answer there is, this is a common cause of snoring and daytime sleepiness. Steve.
What is sleep apnea?
Yes, back on the north side of 100 there, or 0. So you got 100 points. So talk to us about sleep apnea.
Sleep apnea, anybody can get sleep apnea, but typically people with type 2 diabetes are higher at risk. And it's neurologic, but it's also a little bit because of the weight on the central area of the stomach. And so it can really cause daytime tiredness, and there's tests for that. And if your partner says you snore like crazy at night and you have these big periods where it looks like you're dead, but then you breathe, you might have it.
Yeah. And you can treat it with this like CPAP machine that can really help you get a better sleep. And we're learning all kinds of things, that these apneic episodes are not just uncomfortable from waking up. It can lead to high blood pressure, all kinds of problems. So definitely if you notice you're snoring, somebody tells you you're snoring, get it checked out. Okay, so Steve, that was you. Right now, by the way, we got Trish at 700, Steve and Schafer tied for second, if you will, with 100. So Steve, take it away.
You know what? I think let's do the touchy-feely column for 100.
Stay positive for 100.
Yes.
And the answer there is, this is what you call a fellow friend with diabetes. Ooh, Schafer.
What is or who is a diabuddy?
All right. I would have accepted diabuddy, diabesty, any kind of play on words there for diabuddy. So the point there is...
What about type 3?
Type 3 also.
Okay.
I'm glad you didn't get it because you probably would have lost, though. So I was going for diabesty, diabuddy. This is something really, positive about having diabetes, is that you can really relate to other people living with the disease. I know when I'm out, at the supermarket or gym or whatever, and I see somebody with a pump or a CGM, I just really want to run up and talk to them about it, because you can just totally relate to somebody with diabetes.
Well, I was going to say, people with type 2 diabetes do have CGMs now, and they do have pumps, but, if they're swallowing a piece of tree bark, you could say, hey, you got type 2 diabetes.
Well, one of the best things about having diabetes is meeting Steve and having my diabesity, so thanks for that. All right, who got that right?
Schafer.
Schafer. All right, take it away.
All right, let's do lifestyle for 300.
Lifestyle for 300. Okay, new to this category. This macronutrient gets converted to glucose the fastest. Schafer.
What is or what are carbohydrates?
Yes, exactly. Carbohydrates. When we talk about macronutrients, that was a fancy word trying to throw these smart guys off. That's really carbohydrates, fat, and protein are the main things that we put in our body. And when you eat carbohydrates, they can really spike your glucose the fastest. So that's why when you're on insulin, we really talk about counting carbs to taking your insulin, matching the insulin to the carbohydrates. You still have to pay attention to fat and protein, but we put the most weight, if you will, on the carbohydrates, because those are the things that can really kind of jack up your blood sugar.
Yeah, and carbohydrates also typically have a lot of calories in it too.
Yeah.
So people with type 2, you're always battling weight. So I like to look at the food labels that have total calories, and I also look at the carbs.
Even on people that aren't on insulin, we talk a lot about just keeping track of their carbohydrates. Things like snacks tend to be really high in carbohydrates, like our American snacks, chips and crackers and pretzels, all this stuff. So if we can cut back on the carbohydrates, then it really can help your blood sugars.
Yeah. I know that Steve and I tend to kind of eat a lower carb diet. Not because I want to avoid carbohydrates, they're delicious, but it's just an easier way to control your blood sugars when you're limiting, that spike in your blood sugar that can really kind of stress the system. So I think that was you, Schafer. So take it away.
Let's stick with lifestyle for 400.
Okay, lifestyle for 400. The answer there. This is the recommended number of alcoholic drinks allowed per day for a man and a woman. Schafer, you again.
All right. So what is 2 drinks or less for a man and 1 drink or less for a woman?
That is absolutely right. So a couple things there, to talk about. So, I don't know, Trish, you want to talk about alcohol and diabetes?
Yeah, I mean, the one thing I'll say about that count is sometimes people add the count up for the entire week and say, okay, I'm a man, that means I can have 14 drinks tonight on a Friday. And these numbers are not additive, right? So we're really talking about moderation, and I think it's kind of a nice idea with everything with diabetes. So it's not that you're not allowed to have carbs or you're not allowed to have alcohol, but everything in kind of a moderate amount. The one thing about alcohol is it actually can drop your blood sugar lower overnight. There's a great talk in the Video Vault about that if you want to learn more about how alcohol affects your blood sugar.
Yeah, and certain alcoholic drinks are super sweet, like pina coladas and Mai Tais. So you want to stick to drinks that don't have a ton of carbs.
And Tricia, I appreciate you calling it a talk, because really what it was Steve and I drinking alcohol and seeing what happened to our blood sugars. But we did it in a very controlled way. I drank 3 beers. Steve drank 3 old fashions, and also talked about the effects of different types of alcohol on your blood sugars. Sugary drinks versus hard alcohol, etc. So, all right, that was Schafer. So, by the way, we got Schafer at 900, Trish right below at 700. Steve, I'm worried, but I'm pulling for you.
I have a suggestion.
Yeah.
I'm going to switch my buzzer with Schafer's.
No, that's going to mess up the whole system. So, as much as I want to, so you don't complain again, let's just keep rolling, Schafer.
Let's go.
All right, let's do diabetes care for 100.
Diabetes care for 100. The answer there. Be sure to look into getting these checked every year. Steve!
Well, what is your feet or your eyes?
Yeah.
Or your cholesterol level? There's
a shotgun approach there.
There's a whole bunch of these.
But, you're right, there is. But, the quotes around look was supposed to be, a key into your eyes and things like that. So definitely getting your eyes checked every year. So Steve, tell us about that, making sure you're on top of your eye care.
Well, there's such a thing called diabetic eye disease or retinopathy. And the early symptoms of diabetic retinopathy, which is caused by years of poor glucose control, that may not be your fault. There's no symptoms, so you have to be screened. You have to see an eye doctor that knows something about the back of the eye, and they take photographs, they dilate your eyes, and that way you will never go blind. Seeing an ophthalmologist regularly.
This is one of the most important things in diabetes to catch early, because it can be treated and fixed. And so if you're having any of that early disease, it can be sort of nipped in the bud before it causes any problems.
And if you have type 2, you should get seen the minute you're diagnosed, or not the minute, but soon after, because you may have had type 2 for several years undiagnosed. That's important.
Yeah. And I'll admit, I hate getting my eyes dilated. I can't do anything for the rest of the day. And you're worried about something like being found, but trust me, it's always good to get that clean bill of health if that is there, or if there is something, jumping on it early. So definitely make sure to get your eyes checked every year. All right, Steve, you did get that last one right. Unfortunately, it was only 100 points. You're still in last, but I'm pulling for you here, so hit us.
Okay. Drugs for 500.
Okay, big one. Drugs for 500. The answer there is proprotein convertase substilicexin type 9 serine protease inhibitors are more commonly known as Schafer.
So what are PCSK9 inhibitors?
That's absolutely right. And I definitely had to Google that and put it all into one, thing here in the question. So tell us about PCSK9 inhibitors, why they're important, why we need to know about them.
These are great medications to treat high cholesterol and to lower the risk of heart disease and other cardiovascular disease. And they're really powerful, they're really effective, and they're good for people that have really high uncontrolled cholesterol and need that extra help. And also we use them in people that have had problems like with statins, which are great medicines, but sometimes if people have side effects or issues, these are awesome alternatives. So in other words, there's no good excuse not to get a really good treatment to keep your cholesterol under good control.
The other thing I'll say about cholesterol for people with type 2 diabetes is a lot of my patients say, well, my numbers actually look fine. And it turns out that the cholesterol numbers, sorry. But we don't actually look at those numbers all by themselves anymore. We look at your risk for how likely it is that you're going to have a heart attack or stroke. And so even though your numbers on paper may look okay for your cholesterol, there's a good chance that you should be on either these PCSK9 inhibitors or a statin.
And I'll just add, when you say cholesterol, it's kind of a wastebasket term. We're looking at your LDL, and that's what PCSK9 inhibitors do. Jeremy
bad
and
cholesterol, LDL.
Yeah, L for lousy. And then we look at the HDL, we want that high. And then, of course, there's triglycerides. So we don't want to get into too much detail, but it's more than just your cholesterol level. And it's your lipid panel.
Yeah.
It's good.
So I think the point is there's a whole lot of options. These PCSK9 inhibitors are actually injections that you can do once every 2 weeks or even once a month for some of these. So if you can't take a statin for some reason, there's all kinds of options. And you were saying, Trish, there's really no excuse not to jump on your cholesterol. People with type 2 diabetes are at very high risk of cardiovascular disease. And probably the most important thing to reduce that risk is addressing your cholesterol. So make sure you tackle that. All right, next question. Schafer, you've running away at now 1,400, so take it to the next category.
All right, let's do diabetes history for 200, please.
Diabetes history for 200. The answer there is, this was the first person to ever receive a dose of insulin.
I feel like this one's for you, Steve.
Yeah.
I know it. I can't think of it.
Pictures in your deck. You showed him when he was 8 years old.
See that?
Steve! Okay. You were I was watching it. You were actually missing the button.
No, I wasn't.
Yeah, I was seeing
Well,
it.
that's because I had a couple drinks this morning. No, I had my 2.
Okay.
No, who is Ted Ryder?
Sorry, Steve. It was actually this guy, Leonard Thompson, was the first person to get an injection of insulin.
Ted Ryder's the one in my slides.
Yeah, but you have the picture of Leonard Thompson when he was like 80 years old, right?
I always show Ted Ryder.
Okay. Well, we got to update your slides. I'm sorry.
He was second.
All right. So Leonard Thompson, that was back in 1921, I think, when the discovery of insulin. So we've got 100 years now of insulin. And when they injected this kid at the time, they described it as a thick brown muck. This was a very unpurified form of insulin compared to what we have today. And this really was a life-saving, medication that before insulin, people were dying, within 6 months of getting diabetes and things like that. So having insulin, thank God we have it. Leonard Thompson was the first person to get it. And 100 years ago, honestly, wasn't that long ago. To think about before that, we just didn't have insulin. So anyway, Schafer, you still got the board.
All right. I feel like we should have all got that one. It was in the back of my head. Let's keep it easy. How about lifestyle for 100?
Lifestyle for 100. The answer there is, this is the recommended weekly amount of exercise for people with type 2 diabetes. Steve.
What is 150 minutes?
Yeah. So 150 minutes, or we say 30 minutes a day, at least 5 days a week. Steve, talk to us about people always want to know when they have type 2 diabetes, how much should I be moving? What's your spiel there?
Yeah, thank you. I mean, we all come from different areas, and some of us are more in shape than others. Some have been exercising our whole lives, but it's really important to get aerobic exercise. And if you start off by walking just to pick up your mail from the mailbox, so be it, but just increase it slowly over time. And exercise is key. Whatever you can do to do some movement.
And don't get scared by the word exercise. I mean, just physical activity, just moving your body and walking. I mean, that counts. Just get out and get moving.
It definitely counts.
And I think also I always tell people, set goals that you're not going to fail at. So don't say, I'm going to go for an hour run today and really set this unachievable goal for yourself. Start small, set goals that you know you can't fail at. Just walk to the mailbox and back to start. And then like Steve said, just increase slowly.
Yeah. Do what you like. That's key.
Steve, you got the board.
Okay. Let's do, let's go for drugs.
Okay.
For 400?
400, all right. The answer there. These are the trade names of all 4 SGLT2 inhibitor medications. Steve.
Looks like your buzzer's
Yeah,
working.
it's working pretty good.
Yeah.
The trade names, well, here they are.
What are?
What are?
Yeah, I guess. Yeah.
The Jardiance, Farxiga, Invokana, and Steglatran.
Yes, nailed it there, Steve. So, these are 4 great options. You want to talk a little bit about SGLT2 inhibitors?
Yeah, just real briefly, and Dr. Santos and Dr. Boeder are going to talk about them in their lectures later on, but they are a class of medications that have basically revolutionized the way we treat type 2 diabetes, because they started off as being drugs just to lower glucose, and then we have determined through large studies that they can protect the heart, especially heart failure, and protect the kidney. And Tricia, you always talk about how they work really in a funny way. So,
Well, I mean, they make you pee out your sugar, essentially. So it's a pretty simple thought. I think because of that, people lose a little bit of weight. But I think probably the biggest news about these medications is that if you have heart or kidney disease, there's a good chance you should be taking this, even if your blood sugars are well controlled. Even if your A1C is at your goal. And I think that's really a new way of a new way of thinking about these medicines.
Okay.
yeah, that's a great point. People are using these drugs right after metformin if you have heart or kidney disease.
All right, Steve, you have control of the board.
Okay, diabetes history for 100, please.
And the answer there. These 2 guys are credited with the discovery of insulin. Steve.
Who are Banting and Best?
Yeah, Banting and Best. These are 2 Canadians that are credited with discovering insulin and actually won the Nobel Prize for it. So thanks to those guys. All right, Steve, you're making your way.
Okay,
we got Schafer, by the way, 1,400, Tricia 700, Steve 600. You got the board.
Let's go for the last column, good attitude, for 400.
Stay positive for 400. The answer there. You can always blame these people for, quote, giving it to you. Schafer.
I'm not sure why I busted.
Giving diabetes.
Who's second?
Who are your parents?
Yeah, parents.
He just guessed.
That was an educated guess.
So the idea there is that type 2 diabetes is definitely a genetic condition that runs in families. And people are highly predisposed to it. If it runs in your family, your parents have it. So if you want to give them a little bit of crap, you can always blame them for it. All right, Schafer, you got the board.
All right, let's do diabetes care for 200.
Okay, diabetes care for 200. Answer, when you pee in a cup, your healthcare provider is checking for this. Steve.
What is albumin or protein?
Okay, that's right. And what is that in lay terms? What are they looking for?
Yeah, they're just looking to check the function of your kidney and how much kidney damage there is. There's other tests they need to look at, but that's a standard one.
Right. It's pretty simple. In general, we don't have any protein in our urine. So if you do have some protein in your urine, it's a sign that there might be an early diabetes complication. So Steve, now in second place. Trish.
I know.
I never thought Trish
my
won.
buzzer. It's my
last
buzzer.
time. Okay.
My buzzer's
Your
not
buzzer's
working.
slow, it seems like.
So
Okay,
Steve.
let's pick diabetes history for 300.
Okay, answer there. These were the first pills for diabetes. Steve.
What are sulfonylureas?
Yeah, sulfonylureas, SUs. Tell us a little bit about
Well,
them.
you know, they've been around the block a long time. Glipizide, gliburide, glucotrol. They work by stimulating your pancreas to secrete insulin. They've sort of fallen out of favor, but they're still used quite a bit because they're inexpensive and they work well.
Yeah, 1940s, 1950s, something like that.
Even
they
before
came
that,
out.
I think.
All right, Steve, you got the board.
Well, I'm on a roll, so let's do diabetes history for 400.
All right, cleaning out that category. The answer is this guy is credited with giving diabetes its name. Oh, Steve.
Who is Socrates?
It's wrong.
What?
Good guess.
Wait a
though.
second, I'm older than you. I should know.
So I don't think we have any Trish.
No idea.
So Trish, you actually did a talk on this. This guy was on a stamp. So it's who is Ariadius? He's like this guy from Greece who described diabetes as like it was like the opening of aqueducts and people were peeing all the time. So basically, it's been around for a long time since ancient Greece. People were describing it as again mostly people getting high blood sugars. They didn't know it was high blood sugars, but peeing all the time was the main symptom. And this guy is commemorated on a U.S. stamp. So check him out.
Do I lose points for getting the
You
wrong
absolutely lose points
already
for
lost
getting it
Wait,
wrong.
that's not, I didn't know that.
Well, then you don't have to buzz in.
I want to guess Socrates, for God's sake.
Okay,
But it,
your turn.
it sounded good.
It's still your turn.
It's still my turn?
Yeah.
Okay, let's do drugs for 300.
Okay, the answer there. To get CGM covered by insurance, this is a therapy you need to be on. Tricia.
What is insulin?
Yes, and specifically mostly mealtime insulin. So talk a little bit about CGM and type 2s.
So CGM stands for Continuous Glucose Monitor, and it's basically a wearable sensor that you can either wear for a couple of weeks, or now there's one that's implantable and implantable for up to 6 months, actually. And these are great because Schafer and I are going to talk about these in our talk, but essentially they just give you so much more information about your diabetes than just pricking your finger.
Yeah, and you've seen advertisement on television, the Abbott Libre Flash, and then you have the Dexcom, and then you mentioned the Eversense.
Yeah, so if you have type 2 diabetes and you're on insulin, get a continuous glucose monitor. So Tricia, you got the board.
Let's go big with diabetes care for 500.
All right, the answer there. Neuropathy almost always starts in the feet because of this anatomical fact. So Steve, we have to go with you, even though you buzzed early.
I'm sorry. Well, what is the distance from the extremity to the spinal
Yeah,
cord?
exactly. So that was hard to put into a question. But basically, those are the longest nerves that we have in our body. And they start with your feet, and then you might notice some kind of tingling numbness in your toes, and it can kind of go up your leg. And then once it gets to your knees, you might notice it in your fingers or something. So if you just start noticing tingling in your fingers, it's really not neuropathy. It almost always starts in kind of the very bottom of your feet.
I know where you did your fellowship from. we covered that topic so many times.
All right, Steve, second place. Tricia and Steve battling out for second. Schafer commanding lead at first. So Steve, what do you got?
Drugs for 400.
There's no drugs for 400.
Yeah.
Did you mean diabetes care for 400?
I meant diabetes care.
Diabetes care for
Yeah,
400,
same
closing
thing.
out that category.
Thank you.
The quote-unquote treatment for this condition is small, more frequent meals. All right, Steve.
What is diabetic Gastroparesis.
That's exactly right. Way to go, Steve. So tell us a little bit about gastroparesis. I know it's something you struggle with too.
Basically, yeah, thank you. It's a condition where you have neuropathy, not the type that affects your feet, but it slows down the peristaltic motion of your stomach. So when you eat, you get full faster. The food sits there forever. Every meal is like Thanksgiving meal, and then eventually the nutrients leave the stomach and go into the small intestine, and they get absorbed. So it's slow digestion. It can cause havoc with anybody with diabetes.
Yeah, nausea, kind of feeling full after meals. So if you have those symptoms, definitely get it checked out. So Steve, you got control of the board.
Yes.
And knocking on first place.
Okay. Good attitude for 300.
All right, there we go. Answer is, having type 2 may give you access to these classes of medications that can help you lose weight. Tricia.
What are GLP-1 receptor agonists and SGLT2 inhibitors?
Exactly right. So that is, an alphabet of diabetes soup. Alphabet.
Yeah,
what am I trying to say?
say their names so people can recognize the ones on all the commercials.
So, GLP-1s, I think we're going to talk a lot about these in your different talks, but these are two classes of medications that can really help people lose weight. If you have type 2 diabetes, you really should be on these medications, and a lot more on this to come. So, Tricia, you got the board?
Let's do lifestyle for 500.
Lifestyle for 500, big one here. To lose 1 pound per week, you would need to cut roughly this many calories per day. Steve.
500 calories per day.
Yes, but you did not put in the form of question, so this is your third warning.
Oh,
but
God.
yes, that is exactly right.
I appreciate you feeling sorry for me.
Yeah. So 500 calories per day. So to lose a pound a week, a couple things to say there. 500 calories is, it's a bit, but you can be done. But it's helpful to set these realistic goals. If you cut 500 calories a day, you're going to lose a pound a week. So if you want to lose 10 pounds, that could take several months. I think a lot of times people say, I want to lose 10 pounds by Sunday when I go on my cruise or whatever. And you're setting yourself up to fail. So setting these kind of more realistic goals, it can be really helpful.
The other thing about that is just to keep in mind, it's actually a lot harder to exercise off 500 calories than to cut it out of a diet. You have to do quite a bit of exercise to get 500 calories down.
And when you look at those exercise machines in the gym and at your house, and you go into 500, I'm not sure how accurate they are, but it's hard to lose weight. Don't try to lose a ton overnight. Take it slow.
All right, Steve. Steve, you're in first. Woo! When did this happen?
Amazing.
Anyways, your turn.
God, if I didn't miss that other one, Socrates, I'd be killing it. Okay, lifestyle for 200.
And the answer there. Insulin resistance is more prominent at this time of day. Schafer.
What is the morning?
Yes, absolutely. So people have different insulin resistance depending on the time of day. People tend to be more insulin resistant, require higher amounts of insulin, have higher blood sugars in the morning, and in the evening we're the most insulin sensitive. So it's just something to kind of keep in mind. So Schafer.
Let's go drugs for 200.
Drugs for 200. The answer there. Name the 2 indications for using GLP-1 drugs. Steve.
Indications are for type 2 diabetes and atherosclerotic cardiovascular disease.
Okay. So I'll take that. I was going to say for diabetes and obesity are the 2 main indications that we use it for. But you're absolutely right. So when it comes to diabetes, we use these drugs to control blood sugars, all the time. People can use them actually at higher doses just to lose weight. And then you're right, for people with cardiovascular disease, they're approved to lower the risk of cardiovascular disease.
Just like the SGLT2s, sometimes, like Tricia said, sometimes they're used right after metformin if you have risk factors for heart disease.
All right, last question. Steve, do you want to call it out? Stay positive?
Yeah, let's stay positive.
And by the way, there's a lot writing on this. Schafer and Steve can still win. Trish,
I'm out.
You're out, but you can be a spoiler here. All right, so what do we got? Here's the answer. Use your type 2 diagnosis to do this. Schafer.
What is get healthier and live a happier life?
That's absolutely right. What a way to end it. So there's a lot of evidence now that if you take control of your diabetes, you can live a long and healthy life, controlling your blood pressure, your cholesterol, all those kinds of things. If it can inspire you to get control of your diabetes, live a high, healthy life, and live a long and healthy one. Anything you guys want to say to wrap up?
You know what? Bill Polanski always has a slide. Sir William Osler has a famous quote. The way to live a long and healthy life is to get a chronic disease and take care of it.
Yeah. Well, with that, Schafer took first place, Steve second, Tricia third place. Again, you won the first round. It was your buzzer, absolutely. Steve, congratulations for being in the mix.
Thank you.
If you didn't guess Socrates, you would have won, by the way. And Schafer, congratulations. You get $1 million. So just go home and wait for that check. All right. Thanks, everybody, for listening, and we'll see you next time.